Video will show the steps to safely don and doff PPE for airborne respirator contact precautions. Signs like these should be posted in donning and doffing zones near patient care areas. Reference these signs with your trained observer when donning and doffing your PPE. Prior to entering the patient room, remove your badge and any other personal belongings from your pockets. You should only enter the room wearing your scrub top and pants. No jackets or exposed t-shirts. Jewelry should be minimal. It's best not to wear rings or anything other than stud earrings. Your hair should be pulled back away from your face. If you wear glasses, make sure they're secure. Ensure your scrub pants are not dragging on the ground, and make sure that you have a plan with your trained observer for your exit. When donning and doffing your PPE, you'll work with a trained observer. The trained observer's purpose is to ensure that you're following the proper donning and doffing steps to prevent contamination. There are two types of PAPR hoods. The standard hood comes in sizes small and large. To fit, adjust the gray headband to sit on your forehead. The elastic around the chin and face should be snug without any gaps. The shroud is commonly used in settings where it's important to maintain a sterile field, like the operating room. The shroud should be worn under an isolation gown and comes in sizes small and large. Prior to use, perform a machine check of your PAPR device. Press the test button on the battery to ensure a full charge. Attach the battery to the machine and turn on. To perform an airflow test, attach the airflow meter. Ensure the ball blows over the line. After this is complete, perform an obstruction test by covering the airflow port. This may take a few moments, but you want to hear an alarm sound letting you know the machine will alert you when there's an airflow obstruction or your battery is low. The hose attaches to the machine by lining up the silver prong end to the air port and twisting. The other end attaches to the PAPR hood. Gently push it in and you'll hear a click. Give it a tug to ensure that it is secure. To don your PAPR, begin by performing hand hygiene. Fit your PAPR hood to ensure a comfortable but snug fit with no gaps around the chin or the face. It's important to inspect your hood for cracks and tears. If found, the PAPR should be discarded. Next, fit your PAPR machine around your waist and adjust if necessary. It should be comfortable but snug. Tuck the belt to prevent it from dragging on the ground. Next, your trained observer will assist in attaching the PAPR hose to the machine and then the hose to the hood. Gently tug to check for secure connections. For comfort, turn the machine on prior to donning the hood. Next, you'll don your isolation gown, being careful when placing it over your head to not stretch the gown. Secure your gown by tying it in the back. You'll don a clean pair of gloves, making sure to completely cover your wrists. Make sure that your PAPR hose has slack for you to move. Your trained observer will do one final inspection of your PPE prior to you entering the room. When you're ready to exit the room, call out for your trained observer. With clean gloves on, use a sanding wipe to wipe down the door handle. The trained observer will also do this for the outside door handle. Perform hand hygiene over your gloves, and while facing the patient, carefully remove your gown by pulling at the waist first, and then the shoulders. Roll your gown inside out, and remove your gloves with your gown. Perform hand hygiene, and exit into the doffing zone, where you'll meet your trained observer. Upon exit, you'll first perform hand hygiene. Your trained observer will hand you a clean pair of gloves to don, followed by a sanding wipe, which you will use to disinfect your PAPR belt. The trained observer will be donned in droplet contact precautions for the doffing process. The trained observer will begin to disinfect the PAPR hood by wiping back to front, ensuring that the disinfectant stays wet. This may require multiple sanding wipes, however, for purposes of this video, the trained observer is using a single wipe. You may also need to turn around for the trained observer to properly disinfect the back of the hood. After disinfecting the hood, the trained observer will disconnect the hose from the hood. Carefully remove the PAPR hood by lifting up and away, being sure not to touch your face. The trained observer We'll power off the machine and disinfect the hose, the machine, and the belt. When complete, unclasp the belt and place the machine into the proper receptacle. The trained observer will doff her gloves, perform hand hygiene, and don a new pair of gloves prior to disinfecting the PAPR hood. The PAPR hood should be reused for the shift by the same individual. The hood should be thoroughly wiped down with a Sani wipe and hung to dry. Doff your gloves and perform hand hygiene and place a universal mask when ready. The trained observer will doff her PPE in the doffing zone by removing her gown and gloves, performing hand hygiene, and then doffing her face mask onto a clean surface to be disinfected for reuse later. For more information, please visit the Harborview Infection Prevention and Control page on the intranet.